Okay, welcome back. And we are going to move on to chapter 17, which is upper GI. So let's grab that, share my screen. And away we go. Okay, so nutrition and upper gastrointestinal disorders. So we're going to talk about the causes, the consequences, and the nutritional management of things like dry mouth, which is called xerostomia, dysphagia, which is difficulty swallowing, and GERD, gastroesophageal reflux disease. And then we're going to identify some common stomach disorders and summarize medical treatment and dietary strategies that promote healing or can improve symptoms. We're also going to talk about gastric surgeries like lap band, gastric bypass, and what kind of nutritional care is required after them. And we're going to talk about the causes, effects, and treatments of dental caries, which are cavities, periodontal disease, and the relationships between those conditions and other chronic diseases. You would never think that your mouth is connected to your heart, but it is. And you'll find out why, I'm sure. So, diagnosis of upper GI complaints is usually pretty difficult because the physical abnormalities usually aren't there. It's usually just evaluating symptoms and looking at whatever the cluster of symptoms is and saying, all right, well, that this meets the criteria for this disease. And oftentimes GI problems are related to another illness. So they're kind of secondary, which makes it even more complicated. So the first one we'll talk about is xerostomia, and that means you don't have enough saliva. That is a side effect of so many medications. That's one of the primary causes of it. There's also something called Sjogren's syndrome. Radiation therapy for cancer can also cause it. And people that are mouth breathers when they sleep, that can cause it. So people with sinus problems, allergies, those kinds of things. You don't think it's a big deal having a dry mouth, but not having enough saliva, believe it or not, can lead to infections in the mouth, bad breath, and even dental disease. And it makes it difficult for people to speak. You need saliva to keep your mouth moist, to keep it moving, like the way my mouth is constantly going. And people with dentures, if their mouth is dry, which it frequently is, they can wind up with ulcerations in the mouth, which are painful. There's some tips, a little table here about how to manage dry mouth. Sips of water or some other type of sugarless beverage, because things with sugar will actually make your mouth more dry. Sucking on ice cubes or frozen fruit bars, consuming foods that have a high fluid content like soups and stews and those kinds of things, avoiding dry foods like toast and crackers, and staying away from things that are either really spicy or really citrusy, right? Or really sharp, like don't eat a bag of Doritos, right? Because that will hurt. Chewing sugarless gum helps to stimulate salivation. Stay away from caffeine and nicotine and alcohol, all the good things in life. Use a humidifier when you sleep if you're a mouth breather, right? So there's a whole list here of things. There are even over-the-counter saliva substitutes. One is called Biotine that you can buy, and they're like sprays or drops that you can put in your mouth to help moisten it. The next condition is dysphagia. Usually you see this associated with people that have had a stroke. CVA, cerebrovascular accident. And so we have that little flap here called the epiglottis. The epiglottis is meant to shut over the trachea when we're eating and drinking, so that if it stays in the shut position, what we eat and drink goes down into the esophagus instead of going into the bronchus, right? People that have had strokes, because the brain is affected, which affects the whole central nervous system, which affects innervation of the peripheral nervous system, will cause a problem with the epiglottis where it's like a slow or lag response. It doesn't shut all the way. And so people can aspirate. That's a big problem. And there are different subtypes, oropharyngeal versus esophageal. It's usually a problem with the epiglottis though, like I just described. Big complications with this as far as nutrition, because one of the things that you'll find is people with dysphagia will be on a pureed diet. So basically they're eating the equivalent of what looks like baby food. And they're not real happy about that. It's not the most appetizing thing in the world, when you're looking at a plate of food and it's just all mush. And usually they're on thickened liquids, either honey or nectar thickened, which that's prescribed by speech therapy, believe it or not, because they do the swallowing evals. So you're drinking water that's thick and gooey. not very appetizing. And you're eating food that looks like baby food, also not very appetizing. They usually need a lot of encouragement because it's very easy and very quick for these people to become malnourished. I should have shut that off. Let me do that now. So they differentiate the different types of dysphagia, oropharyngeal versus esophageal. And you will see things like, advanced Alzheimer's, for example. People literally forget how to eat and swallow. That's very sad. Amyotrophic lateral sclerosis, which is Lou Gehrig's disease, which is central nervous system disease and peripheral nervous system, brain injury, cerebral palsy, the list goes on and on. So there are lots of, neurological disorders that affect, the ability to swallow. Dysphagia diet, and it just talks about what I just talked about, puree diet and honey and nectar thickened liquids. And then there's one trick that people can use. Whenever you see somebody like swallowing a pill, don't people just instinctively drink and put their head back? That's the wrong way. If you want to keep the epiglottis in a closed position, you chin tuck. So in other words, put the pill in your mouth, take a sip of whatever you're drinking, head down, swallow. You force the epiglottis anatomically into a closed position. You can't choke. It can't go into your trachea. Right. So that's one thing that speech therapy will teach patients, to do that chin tuck position. They'll even do exercises to help strengthen the jaws, the tongue, the larynx, those kinds of things. And that's all speech therapy. Next disease is GERD, gastroesophageal reflux disease. And what happens here is the stomach has hydrochloric acid in it. Hydrochloric acid, if I could take the acid out of everybody's stomach that's in here tonight and put it in a barrel, you could get rid of a body, bones, teeth, everything. True, true. That's the strength. That's the strongest acid that exists, right? And so that's in your stomach. And the reason that it's there is when you eat food or drink whatever, the hydrochloric acid gets produced and it helps to actually start to break down the food into something called chyme. And that even like resembles baby food, like a pureed, mushy type of substance that gets released from the stomach into the small intestine, where then all the nutrients can get absorbed from that food. But what happens with GERD, you have something called the lower esophageal sphincter. So at the bottom of the esophagus, where the esophagus and the stomach meet, there's this one-way flap. Everything in your body is like South Philly. It's all one way. Nothing should ever go backwards, right? So when you eat or drink, goes down the esophagus, and then that lower esophageal sphincter will open. The food can go into the stomach and it's supposed to slam shut, right? If you're pregnant women, especially towards the end of the pregnancy, will get heartburn a lot. Why? Because all the weight of the baby pushing on the stomach is pushing the stomach, pushing the acid up, pushing that sphincter open and pushing it up the esophagus. So that's that burning sensation that you get in your throat. That's that hydrochloric acid going into the smooth muscle tissue of the esophagus. And it hurts, right? People that are obese, if you're carrying a lot of weight, especially when they lie in a supine position on their back, all the weight is pushing on the stomach. And again, pushing that acid, right, up in there. And then there can also be, anatomical anomalies where that sphincter doesn't close properly because of some kind of structural issue. That can be repaired surgically. With pregnancy, once you have the baby, problem solved. Obese, lose weight, problem solved, right? So, if it causes complications, which it can over time. So if you get heartburn a lot, it's a problem because that acid could be wearing away, eroding the esophageal lining, and that's not good. So we have medications that we use, very, very common ones like Prilosec, omeprazole, which is a proton pump inhibitor. That's over the counter, right? People use that all the time. The best thing you can use though are the quick relief ones like Rolaids or Tums. But you don't overuse them because they're like calcium carbonate is the active ingredient in Tums. So some people will not read the label and just be popping Tums all day long. That's bad because now you're taking in too much calcium, right? There, too much of a good thing is just as bad as not enough, right? And we used to see that a lot in the ER with older folks. Milk of magnesia. It's magnesium, right? And the problem is they'd be taking it every day and then they wind up with electrolyte imbalances, right? So let's see. And then we've got some pictures here about gastroesophageal reflux disease, and it basically has pictures of what I just described to you. the epiglottis and the esophagus, etc. And then the results, what I already explained to you, reflux, esophagitis, damage to the lining, painful swallowing, etc. And one of the easiest things people can do if they do have chronic GERD, when you eat, don't lie down right away. You should be upright in an upright position for at least 2 hours after you eat a meal before you lie down. If you absolutely must, then you should at least be at a 15 to 30 degree angle in the bed. So, put a couple pillows under you to get your head upright a little bit so that you're not completely supine or flat. Yeah. Yeah. Yep. That's a good rule of thumb. You should, and I mean, I'm guilty of this. Sometimes you're exhausted, I'm starving, let me eat something. And then, oh my God, I'm so tired, let me lie down. And it's the worst thing. When you're young, your body will compensate. When you get to this age, your body will go, oh, no, you don't. What are you, crazy? Nah. So, it'll remind you that you shouldn't be doing these things. All right, dyspepsia. Dyspepsia is just a medical term for indigestion, right? Again, another thing that's really vague and hard to kind of pinpoint because it could be something chronic. It could be caused by medications or too many supplements, which are not good. But then things like lactose intolerance can actually mimic, indigestion, dyspepsia. But they don't really have too much research to back that up. Sometimes it's something simple like you ate too fast. You just ate your food, you were starving and you ate too fast and that's what happened. Sometimes people can have nausea and vomiting that accompany the dyspepsia. Then that can be a problem. Not so much for people, your age per se, but the very young and the very old. Just a couple times vomiting, they can have an electrolyte imbalance and require hospitalization. Right. So, let's see, restore hydration, IV fluids, et cetera, et cetera. For people that are pregnant, there's something called hyperemesis gravidarum. And that's morning sickness to like the nth degree. So where they can't keep anything down. They're just vomiting and vomiting. And they usually have to be hospitalized and given IV fluids and electrolytes to balance that out. And then we have medications, ondansetron, which is Zofran. It's an antiemetic, works great. Very few side effects, not as many as the old school antiemetics. Antiemetic means make you stop throwing up. Gastritis. Itis at the end of a word is inflammation of. Gastro refers to the stomach. Inflammation of the stomach basically is what gastritis is. It can be because of infection. It can be because you ate, too many hot wings at the football game the other night. And basically it can cause long-term problems if it's chronic because things like vitamin B12 absorption happens in the stomach. You need intrinsic factor, which is in the stomach to absorb vitamin B12. Chronic gastritis will impair the ability to produce intrinsic factor, which will impair your ability to absorb vitamin B12, which will lead to pernicious anemia. So, yeah, so everything affects everything. It literally does. Everything is interconnected in your body. Interventions for gastritis, it depends on what the cause is, really. Try to avoid irritating foods, stay away from hot, spicy foods. They're usually a culprit. And supplements if necessary, if there's a problem with B12. Peptic or gastric ulcers. The word ulcer means an erosion of the lining. And so what can happen is the hydrochloric acid mixed with something called pepsin can actually erode away either the lining of the stomach or the lining of the esophagus or the lining of the small intestine, the beginning of the small intestine usually. An infection called H. pylori is one of the major culprits. We know this now. Over years, we found this out. And there's a simple breath test that we can do in the hospital to determine if you have H. pylori in your gut. And that's easily treated with antibiotics and proton pump inhibitors. Like it's an easy fix. Chronic use of certain medications, NSAIDs, which are ibuprofen, like Advil and Motrin, naproxen, which is Aleve, celecoxib, which is Celebrex, meloxicam, which is Mobic. All of those meds that are used for like inflammation, arthritic pain, right? Those kinds of things. Chronic use of those can erode away the lining and cause an ulcer, right? And stress, yes, stress can do it too. And too much smoking. The symptoms are strange because they feel better when the person eats. That's when they have relief. So when their stomach is empty, it's painful. When they eat, the pain gets relieved. And that's a telltale sign that it's an ulcer. And then once a few hours go by after they've eaten, stomach's empty again, starts to hurt again. And usually right here, epigastric pain, right at the stomach. And, again, I already talked about what the kind of medications are used for H. pylori, and discontinue those meds if that's the cause of it. Let's see, gastrectomy. So one of the things that people that are morbidly obese can do is different types of gastric surgery, right? And so gastrectomy, gastric bypass, lap band, all of those procedures are either, removal or closure of part of the stomach. So what we're doing is we're making the stomach smaller, right? Gastrectomy is usually due to cancer. So if the person has stomach cancer, we either remove part or all of the stomach. And that's a real problem, because then they wind up with something called dumping syndrome. If you have no stomach, the food's going right from your mouth to your esophagus and then directly into the small bowel. And so they will literally eat, go to the bathroom. That's dumping syndrome. These are the only people that have to lie down immediately after they eat to try to, like, gravity help a little bit so the food stays in a little bit longer. Now, and people that have had any kind of gastric surgery because of obesity, like a lap band procedure or a gastric bypass, we're basically making the area of the stomach smaller. So they can't eat a big meal. They literally can eat teeny tiny little portions, right? And so, it changes the way they eat. And I say this all the time, small frequent meals is the way to go. If you consistently eat, big meals, you can stretch your stomach. And so it takes more food consistently for you to feel satiated or full. So, and that's a problem, which leads to obesity, right? Right. Oh, look, dumping syndrome. I already talked about that. And all the interventions that I already talked about. I'm ahead of the PowerPoint. Let's see. And bariatric surgery. That's what that's called. Weight loss surgery is called bariatric surgery. Right after the surgery, they can only have liquids for a period of time. And it starts with clear liquids, and then it moves on to full liquids, and then soft foods, and then it slowly will progress over a few weeks to food, regular food and tiny portions. There is a nice chart on slide 35 that shows the different types of procedures that are used for severe obesity. There's a sleeve, gastric banding, and gastric bypass, and it shows exactly what they're doing anatomically with each of those procedures. The thing with that is there's usually rapid weight loss. So after gastric surgery, my daughter has a friend actually that had gastric surgery done, and she lost 225 pounds. She was a big girl, yeah. So, and I mean, the weight, she looked like a different person. The weight was just falling off of her. But the problem with that is, what do you think the problem with that is when you're losing so much weight so quickly? Well, that's it. We went right to the aesthetics. Your skin's hanging, you got to get it fixed. Yes, that's definitely an issue. And she had to have surgery to fix that too down the road. But other than that, so you have other problems with your body as far as nutrients. There's a big risk of cholecystitis, which is inflammation of the gallbladder, because you're losing so much weight so quickly. The body systems that have been in place are like, whoa, but the gallbladder is a storage facility for bile. So your liver makes bile, sends it to the gallbladder concentrates the bile and hangs on to it. And then when you eat McDonald's with all that fat, it releases the bile through the common bile duct into the small intestine. And you need that bile to absorb and metabolize all the fats, okay? So now you're not eating like that anymore because your stomach is now only this big. Your gallbladder's like, oh, what's going on here? I got all this bile and nowhere to put it. So it will typically get inflamed. It's very common for people to have their gallbladders removed after bariatric surgery. And they can wind up with anemia because of not getting enough protein and B vitamins. Lots of other things can happen. You have to be really super careful after bariatric surgery. And then the last thing on the list is cavities. So, there are different infections that affect the structure of your teeth. Saliva is a protective agent. So it actually has antibacterial action for certain types of infections. So the saliva protection. Plaque in the teeth can actually lead to dental caries. It can also lead to periodontal disease. And I said in the beginning about your heart and your mouth, how they're connected. So people that have any problems with the valves in their heart, so like mitral valve prolapse, for example, which is a common disorder, they need to let their dentist know, because they need to pre-medicate with antibiotic before they get their teeth cleaned. Because when you get your teeth cleaned and they scrape all the gunky plaque off your teeth, some of it gets absorbed systemically and it can cause an infection in heart, pericarditis. Right? How about that? I've never had a cavity. None of my kids have ever had a cavity. That's true. I can't say, well, I was very, fastidious. I mean, I brush my teeth and I floss and everything, but it's genetic, right? Very, very lucky. But I know people that have had cavities and root canals, and it doesn't sound like fun, so one of the best things you can do is just, see your dentist. Good tooth care. It's really important, because your mouth really does have a connection to all the rest of your body. Even though you don't necessarily make that connection, it does. Personal hygiene, floss your teeth, brush your teeth, don't smoke. I said that a lot tonight, didn't I? Don't consume excessive amounts of alcohol. Stay away from sugary foods. That's the other thing too, the more sugary foods you eat, if you don't brush your teeth right away after you eat them, sitting in your mouth, it's going to eat away at the enamel, and see a dentist on a regular basis. And that's the last slide in this. This wasn't as bad as the last one though, was it? All right. So I'm going to stop sharing and we are done with this. Peace out.